Your body has been trying to reach you. Not loudly, not with chest pain or collapsed veins or a number on a machine that sends you to the emergency room. Quietly, patiently, the way a house makes sounds before the foundation cracks. Small, easy to explain way, easy to sleep through. It has been sending the messages to the one place most people never think to look: their feet. Right now, before this video is over, you are going to learn to read those messages, because the signals your feet carry about your blood sugar are not vague, they are not general, they are specific, biological, and in most cases visible to the naked eye. And here is the part that should stop you cold. Research supported by the American Diabetes Association suggests that the physical signs of elevated blood sugar can appear in the body more than a year, sometimes 2 years, before a blood test ever catches anything. More than a year of your body sending signals, more than a year of messages going unread. The blood test is not the early warning system. Your feet are. There are stages to this, 3 of them. The first stage is easy to miss. The second stage is easy to explain away. By the third stage, the window for simple intervention is closing, and most people are still waiting for a lab result to tell them something their feet have been saying for months. We are going through all 3 stages today. Stay with me. If you are over 55 and you want health information that goes deeper than a 3-minute appointment, subscribe right now and hit the bell. This channel publishes evidence-based content every single week that most people never hear outside a specialist's office. Now, let's get into the 3 stages. Stage 1. The whispers. The signals your feet send first, the ones almost everyone misses. Signal A. The texture of your skin has changed. Not how it looks, how it feels. Run your hand across the top of your foot right now. Not the bottom, the top, and then across your lower shin. Does it feel different from the skin on your arm? Thinner? Papery? Almost too smooth, like the surface has been gently sanded down? Does it feel fragile in a way that is hard to describe, like the skin is doing less than it used to? That texture change is not aging. It is a blood supply problem. When blood glucose stays elevated over months and years, the small blood vessels, called microvascular vessels, that feed the outer layers of skin begin to sustain damage. The capillaries that deliver oxygen and nutrients to skin cells narrow. The skin on the feet and lower legs, which sits at the furthest end of your body's circulatory route, is the first to show the effects of that narrowing. The result is skin that becomes thinner, drier, and less elastic. Skin that looks and feels older than the rest of your body because it is being undernourished at the cellular level. Think of it like this. Every cell in your skin is a small living organism that needs a constant delivery of oxygen and nutrients to stay healthy. That delivery comes through blood vessels. When those vessels narrow, the way a garden hose narrows when someone is standing on it, the delivery's slow. The cells receive less. The skin becomes fragile. It loses its normal feel. This is stage 1 signal A because it is the earliest visible sign of microvascular compromise, and it is sitting on the top of your foot right now if you know what you are touching. What to do? Moisturize both feet every night before bed. This does not fix the underlying blood supply issue, but it protects fragile skin from cracking, which matters because cracked skin on a poorly nourished foot is an open invitation for infection. Use a thick cream or pure coconut oil on the soles and heels, never between the toes. Trapped moisture there breeds fungal infection. Signal B. Your toenails have changed. The detail nobody looks at that tells you everything. When did you last look closely at your toenails? Not a glance when you're cutting them, a real look, under good light. Are they thicker than they used to be? Yellowed? Growing more slowly? So slowly that you cut them less often than you did 10 years ago. Do they have a slightly dull, opaque appearance instead of the normal translucent pink? These are not cosmetic concerns, they are circulation reports. Toenails require a constant supply of oxygenated blood to grow normally. The nail matrix, the tissue at the base of the nail responsible for producing new nail cells, is highly sensitive to changes in blood flow. When the microvascular supply to the feet is compromised by blood elevation, nail growth slows. The nail plate thickens as it grows more slowly and cells accumulate. The color changes as oxygen delivery falls. Research in podiatric medicine has suggested that nail changes in the feet, particularly thickening, slowed growth, and discoloration, can serve as early visible indicators of microvascular disease in patients with elevated blood sugar. These are signs that podiatrists are specifically trained to assess as part of diabetic foot screening. Slow-growing, thick, discolored toenails on a person over 55 are not just a grooming concern. They are a message. What to do? Examine your toenails monthly. Note whether they are growing at the same rate they used to. If you notice significant thickening, yellowing, or dramatically slowed growth, bring it specifically to your doctor's attention at your next visit. Ask for a fasting blood glucose test if you haven't had one in the last 12 months.
Signal C. Your feet sweat differently than they used to, or they have stopped sweating almost entirely. Think about the last time your feet were genuinely sweaty. Not after exercise, on an ordinary day, in ordinary shoes, in ordinary temperature. If you cannot remember if your feet seem unusually dry most of the time, if the skin on your soles feels parched, even in summer, if no amount of moisture from the outside seems to stay, that change in your sweat pattern is one of the earliest signs that a specific branch of your nervous system is under stress. Your feet contain a high concentration of sweat glands. Those glands are controlled by your autonomic nervous system, the branch of your nervous system that manages the automatic, involuntary functions of your body: heart rate, digestion, body temperature regulation, sweat production. When blood sugar stays elevated for extended periods, the autonomic nerves are among the first to sustain damage. This is called autonomic neuropathy, and one of its earliest, most overlooked manifestations is a change in the sweating pattern of the feet. The feet stop producing their normal moisture from the inside. They become abnormally dry. The skin cracks, not because of weather or dehydration, but because the internal moisture production system has been disrupted by nerve damage. No lotion fixes this because the problem is not on the surface. The problem is in the nerve. This distinction matters. If you have been applying moisturizer to cracked heels for months or years without lasting improvement, you have likely been treating the surface of a problem that lives much deeper. The American Podiatric Medical Association identifies chronic, treatment-resistant dryness and cracking in the feet as a significant indicator of autonomic neuropathy in older adults. What to do? If your feet are consistently dry, regardless of how much moisture you apply externally, tell your doctor. Use exactly those words. My feet are abnormally dry, and nothing I put on them seems to help. That description will immediately direct a knowledgeable clinician toward the right diagnostic questions. Those are the 3 stage 1 signals, the earliest whispers your feet send before anything else. Have you noticed any of them? The texture change on the top of your foot, the toenail changes, the unusual dryness? Drop a comment right now. Just type stage 1 if any of those apply to you. I read every single comment. Keep watching, because stage 2 is where the signals get louder, and louder means the window for easy intervention is already narrowing. Stage 2, the louder warnings, the signals your feet send when the whispers weren't heard. Signal D, a sensation inside your foot that has no outside cause, the feeling your nervous system manufactures on its own. It happens at rest. You are not standing, you're not walking, you are sitting in a chair reading or lying in bed waiting for sleep. And somewhere in your foot, in the sole, in the arch, along the outer edge, there is a sensation that does not belong. It might be tingling, a pins and needles feeling that comes and goes without explanation. Or it might be something sharper, a brief electric pulse, a sudden stabbing that passes as quickly as it came. Or a warmth that builds slowly, like your foot is being held near a heat source that is not there. None of these sensations have an outside cause. No weight on the foot, no pressure, no temperature change in the room. They are generated entirely from inside the nerve itself. The mechanism is this. Nerve fibers are coated in a protective layer called myelin, a fatty insulating sheath that ensures electrical signals travel cleanly between the brain and the body. When blood sugar stays elevated for extended periods, the autonomic nerves are among the first to sustain damage. This is called peripheral neuropathy and recognized by the American Diabetes Association as the most common complication of diabetes, affecting close to half of all people with the condition. And it almost always begins in the feet because the nerve fibers running to your feet are the longest in your body, and longer fibers are more vulnerable to the metabolic damage caused by excess glucose. Research in diabetes medicine has suggested that these sensations frequently appear 1 to 3 years before a formal diabetes diagnosis, making them one of the earliest warning signals available to a person paying attention to their own body. What to do? A daily 20 to 30-minute walk. When your leg muscles contract with movement, they activate a glucose transporter in muscle cells completely independent of insulin that pulls sugar directly out of your bloodstream. Every step is removing the metabolic fuel that is damaging your nerve myelin. This is not generic exercise advice. It is the specific biological counter to what is happening inside your foot right now.
Signal E, the color of your lower leg is changing. The distress signal written on your skin that most people never connect to blood sugar. Stand up for a moment if you can. Walk to a mirror or a window with good natural light. Look at your lower legs, from the ankle to just below the knee. Compare them to the skin on your arms or your upper legs. Do you see a difference in color, a darkening, a reddish or brownish tint that is deeper around the ankle than higher up? Has anyone ever commented on the color of your legs, or have you noticed it yourself and decided it was just the way your skin looks? That color change is your skin reporting a blood supply problem it has been living with for months. When the small blood vessels in the lower legs sustain damage from elevated glucose, the tissue in those areas receives less oxygenated blood than it needs. Deoxygenated blood, blood that has already delivered its oxygen and is waiting to return to the heart for a fresh supply, pools in the lower extremities. It gives the skin a darker, more reddish or brownish appearance. The deeper the color change, the longer the blood supply has been compromised. In some people, the skin also becomes visibly thinner in those areas, almost translucent, with the underlying vessels more visible than they should be. This is the skin telling you that the tissue beneath it is malnourished. Think of it as a report card your circulatory system writes on your skin every single day. Most people read the words and do not recognize the language. Research published in dermatology and diabetes literature has suggested that these visible skin changes in the lower extremities can appear significantly ahead of a clinical diabetes diagnosis, making them a potentially valuable self-screening tool for adults over 55 who have risk factors but have not yet been tested. What to do? Ankle circles, calf raises, and toe flexes 5 minutes every morning before you get out of bed. These movements activate the calf muscle pump, the muscular mechanism in the lower leg that assists the heart in pushing blood back upward against gravity. Even 5 minutes of deliberate lower leg movement in the morning begins counteracting the blood pooling that is causing the color change you are seeing. Signal F, swelling that leaves a mark. The message your kidneys are sending through your ankles. At the end of the day, you take off your socks. The elastic has left a deep ring around your ankle. You press your finger into the swollen skin above your ankle bone. The indentation stays. It fills back in slowly over several seconds rather than springing back immediately the way healthy tissue does. This is called pitting edema, and it is not a foot problem. It is a kidney problem that your feet are reporting. The kidneys are responsible for filtering excess fluid from the body and excreting it as urine. When blood sugar has been chronically elevated, the filtering structures inside the kidneys, called glomeruli, sustain progressive damage. As their function declines, fluid that would normally be processed begins to accumulate in the body instead. Fluid follows gravity. It collects at the lowest point. For a person who is upright and walking during the day, the lowest point is the feet and ankles.
By evening, the accumulated fluid becomes visible and palpable. The National Kidney Foundation recognizes diabetic kidney disease, also called diabetic nephropathy, as one of the leading causes of kidney failure worldwide, and lower extremity swelling with pitting edema is one of its earliest visible signs. This means the swelling around your ankles at the end of the day is not a minor inconvenience. It is a signal from one of your most vital organs. What to do? When you rest in the evening, elevate your feet above the level of your heart. Even 4 to 6 inches on a firm pillow achieves meaningful fluid redistribution. Reduce sodium intake. Dietary sodium causes the body to retain water, dramatically worsening fluid accumulation. And if this swelling is new, getting worse, or present when you wake in the morning rather than only at the end of the day, bring it to your doctor immediately. Morning edema is a more urgent sign than evening edema. Stage 2 signals are the ones most likely to be sitting in the body of someone you love right now, a parent, a spouse, a sibling, who has no idea what they mean. Share this video with them before you watch Stage 3. Tag them, send them the link, because Stage 3 is the stage where the options start narrowing, and I need them to see this too. Stage 3, the final alarms, the signals your feet send when the earlier messages were missed. Signal G, a wound that will not close, the most dangerous sign on this entire list. 3 weeks ago, it was a small thing, a blister from a shoe, a minor scrape, a nick from a toenail clipping, something that should have been gone in 4 days. It is still there. Not dramatically infected, not black or gangrenous, just open, stalled, refusing the normal progression of healing that has worked every time before. You are waiting. Stop waiting. When blood glucose stays elevated over extended periods, 2 parallel processes occur that devastate wound healing in the feet. First, the small blood vessels that supply the wound site with the oxygen, white blood cells, and repair proteins needed for tissue regeneration have been narrowed and stiffened. The healing materials exist in your blood. They cannot reach the wound site in sufficient quantity or speed. Second, elevated glucose impairs the function of neutrophils, the immune cells that form the first line of defense in an open wound. The wound's defenses are compromised at the same time that its healing is compromised. An open wound on a foot with these 2 conditions is not healing slowly. It is not healing at all. It is waiting for infection. The Centers for Disease Control reports that diabetic foot complications are the leading cause of non-traumatic lower limb amputation in the United States, and the progression from small wound to serious complication is not slow. It is predictable, and it almost always begins with a wound that someone decided to watch for another week. Do not give it another week. What to do starting tonight? Examine both feet under good light after your shower. Look at every surface between the toes, the heels, the ball of the foot. If you find any wound that has been present for more than a week without clear improvement, clean it thoroughly, cover it, and call your doctor tomorrow morning. Not for an appointment next month, tomorrow. A wound on a foot with compromised circulation and compromised immunity is a medical situation from day 1.
Signal H, pain that wakes you up, the alarm your nervous system sounds in the dark. It hits at night, not during the day when you are moving and distracted, at night when the house is quiet and your nervous system has nothing competing for its attention. A stabbing in the arch of your foot, an electric pulse along the outer edge, a deep bone-level ache that ibuprofen dulls but never fully silences. Pain that seems to have no injury behind it, no fall, no strain, no obvious cause. You have been managing it, medicating around it, explaining it as old age or an old injury or the shoes you were wearing last Tuesday. But here is what is actually happening. When nerve fibers sustain significant damage from chronic elevated glucose, they do not simply stop transmitting signals. In many patients, they become hyperactive, firing intense, random pain signals continuously without any physical stimulus triggering them. The nerve is damaged, it is misfiring, and every misfire feels like a real injury, a real burn, a real electric shock, because as far as your brain is concerned, the nerve said it happened, and that is enough.
This is called painful diabetic neuropathy, and it is distinct from the earlier tingling and burning of stage 2. This is louder, more insistent, more disruptive. It is the nervous system running out of ways to whisper. Research in neurology has suggested that painful neuropathy of this type is frequently misdiagnosed as arthritis, plantar fasciitis, or general age-related joint deterioration because the pain is real and the location is real, even though the source is nerve dysfunction rather than structural damage. This distinction matters because the treatments are entirely different. Pain medication manages the symptom, only blood sugar management addresses the cause. What to do. If you are taking over-the-counter pain medication regularly for foot pain, tell your doctor specifically that the pain is in the feet, that it is worse at night, and that it feels like burning or electric shocks rather than a dull ache. Those specific descriptors will direct your doctor toward the correct diagnostic pathway. A fasting blood glucose test costs approximately $12. It can determine within 24 hours whether your pain has a metabolic origin. Signal I. Your feet are cold from the inside. The last signal, and the one that tells you how long this has been building. Your feet are cold. Not cold from the room, not cold from inactivity, cold in a way that blankets do not fix, cold that is present in summer, cold that sits in the foot itself, deep below the skin, like the warmth has simply stopped arriving. You have had this for years. You have joked about it. You have been stealing the electric blanket in July. This is not a quirk. This is your peripheral circulation telling you it has been struggling for a long time. This condition, peripheral artery disease, or PAD, occurs when the arteries supplying the legs and feet have narrowed significantly through a combination of atherosclerotic plaque buildup and vessel wall stiffening driven by chronically elevated blood sugar. When the arterial channel narrows, warm, oxygenated blood cannot reach the feet in sufficient volume to maintain normal temperature, regardless of how warm the environment around them is. The feet are cold because the fuel for warmth, oxygenated blood, is not arriving in adequate supply. The American Heart Association recognizes diabetes as the single largest risk factor for peripheral artery disease, and persistently cold feet, feet that are cold independent of environmental temperature, are one of PAD's most consistent early symptoms. This sign does not stand alone. If you are experiencing cold feet alongside any of the earlier signals in this video, the skin texture change, the toenail changes, the tingling, the swelling, the slow healing wound, you are looking at a pattern, not a coincidence, a pattern that points in one direction. What to do? A 30-minute brisk walk every day. Movement is the most evidence-supported non-medical intervention for maintaining peripheral circulation. It creates mechanical pressure in the vessels of the legs and feet that counteracts the narrowing process. It stimulates the growth of small collateral blood vessels that bypass damaged ones, and it activates the glucose disposal mechanism in muscle cells that directly reduces the blood sugar driving the vascular damage in the first place. Start with 10 minutes. Do it today, not next week. What these signs are building and what they are building toward. You have not felt the microvascular damage happening in your feet. You did not feel the myelin thinning around your nerve fibers. You did not feel the glomeruli in your kidneys losing their filtering efficiency. You did not feel the arterial wall stiffening. You did not feel any of it because the body does not alert you to process. It alerts you to consequence. The tingling, the cold, the wound that wouldn't close, the sock mark at the end of the day. Those are consequences, and by the time the consequences are visible, the process has been running for years. Here is the quiet arithmetic of what happens when the signals go unanswered. The tingling becomes numbness, permanent numbness, not the sleeping foot kind, the kind where you step on a nail and don't feel it. The slow healing wound becomes an ulcer, the ulcer becomes an infection, the infection reaches bone. The swollen ankles become a kidney function conversation, then a dialysis conversation. The cold feet become a circulation intervention conversation, then a surgical conversation. None of this is written in your biology. None of it is inevitable. Every single stage of this progression has a point of interruption, a moment where a different choice, a different meal, a different daily walk, a different conversation with a doctor changes the destination. You are at one of those points right now. The signals are readable. The window is open. What the research says about going backwards. Blood sugar responds to dietary change and physical activity with measurable speed. Research in metabolic medicine has consistently shown that lifestyle intervention, reduced refined carbohydrates, increased fiber, and daily movement produces meaningful improvements in fasting blood glucose within weeks in many people. Early peripheral neuropathy, the tingling and burning of stage 2, can stabilize and in some cases partially improve when blood sugar is brought under sustained control. The damage that has occurred does not fully reverse, but its progression halts. The signals are quiet. Research in vascular medicine has suggested that vascular changes in the lower extremities, the blood supply issues driving the skin changes, the temperature changes, and the swelling show measurable improvement in patients who achieve sustained blood sugar control alongside regular physical activity. The body you have right now is not fixed. It is responsive. It responds to every meal, every walk, every glass of water in real time. The question is what you ask it to respond to. Your body has been trying to reach you. You know that now. 3 stages, 9 signals, a communication system that has been running, patient, persistent, specific in the feet you have walked on your entire life. Tonight, before you sleep, sit on the edge of your bed. Take 2 minutes, look at both feet under a good light, run your hand across the top, check the toenails, note whether the skin is unusually dry, look at the color of your lower legs. 2 minutes, and if what you find matches anything in this video, a signal in stage 1, stage 2, or stage 3, make one phone call tomorrow morning. Ask for a fasting blood glucose test. That's all. One call. One test, because the most expensive thing your health will ever cost you is waiting until the signals become impossible to ignore. You heard them today. Now you know what they mean. 3 stages, 9 signals, and now you know how to read every one of them. I want to hear from you. Which stage are you in right now? Stage 1, the early whispers, stage 2, the louder warnings, or have you been living with a stage 3 signal and telling yourself it was something else? Drop it in the comments, just your stage number, or type the signal that resonated most. I read every comment on this channel and I will reply to as many as I can. If this video gave you something your doctor has not had time to explain, please hit the like button right now. 1 second. It tells YouTube to put this in front of more people over 55 who need it. Subscribe and hit the bell, because next week we're covering the 7 things your blood pressure is trying to tell you that have nothing to do with salt, and most people over 60 are missing all of them. Share this with someone's feet you are worried about. You might be giving them the most important 2 minutes they spend this year. Your body is talking. Listen to it.